Hello, everybody. This is Dr. Serge, and today I wanted to talk about a really important topic, actually, heart disease. Heart is one of the things that I'm really passionate about. Actually, I did a postdoctoral fellowship at Harvard Medical School studying heart disease, what to do to reverse heart disease, and what to do to prevent heart disease. As a matter of fact, back then I was working on stem cell therapy using different tools based on stem cells to regenerate the heart after a heart attack. Because after a heart attack, up to 40% of the muscle of the heart dies. So, and there's ways with stem cell to, of course, get the muscle working back again. Technology, it's pretty young, so we don't really know what to do, but it's really promising. But at the end of the day, what do we need to do right now to help with heart disease? People don't realize that there's more than 250 factors associated with heart disease. Associated doesn't mean that they cause heart disease, but there's a connection with heart disease. For example, we've seen in the 50s and 60s that more TVs you had in your house, more heart problem there was among the members of the family. People didn't believe that TV would cause heart disease, but there was an association. So it's more complicated than just checking your cholesterol. And this is what this article is all about. Is they showed that, as we can see here, that the totality of the new evidence compels us to question why our current approach to heart disease prevention through targeted reductions of LDL cholesterol is not working. But that was my point today is targeting cholesterol does not work. We've been doing this for decades and decades using statin or other drugs that lower cholesterol, and nothing is working. Those people put a statin still have heart problem. Actually, as a matter of fact, the major side effect of statin is a heart attack. So if you take medication, actually you have a higher risk of heart attack than if you were not taking statin. And today we know that the best blood numbers for cholesterol is in the 250, 300 range. So if your cholesterol gets too low, you have actually a higher risk of mortality of all causes compared to people who have a higher rate of cholesterol. The Monica study done in Europe among about 30 countries showed that people with the highest blood level of cholesterol has the longest lifespan. So meaning that they were living the longest, and on top of that, they were living the healthiest. So targeting cholesterol is really it's totally wrong. It's not supported by science. I do not recommend people to be put on cholesterol medication. It doesn't work, and you have higher risk of heart attack, cancer, osteoporosis, brain damage, diabetes, liver problem, muscle issues, and so on and so on. So statin is one of the worst medications in general out there. So what do we need to do to help with cholesterol? So like I said, there's more than 250 factors. So it's not as simple as what people believe. One of the major driver of high cholesterol is stress. So when your body undergoes a long period of stress, your body makes stress hormone, and those stress hormones need cholesterol as a backbone. So if you are under stress, so your body naturally will produce more cholesterol. Okay, your liver, for example, is one of the main sites of cholesterol production. So your liver will start making more cholesterol naturally to help with stress, to help with sex hormone, estrogen, progesterone, testosterone, to help with a bunch of hormones. So lowering your cholesterol with medication, for example, can mess up your hormones as well, your sex hormones. And then another factor we need to look at is your carb intake, sugar. Because carb, sugar, starches lead to a higher insulin to your blood, and insulin stimulate your body to make more cholesterol. Usually, clinically, these are the two things that I see that helps a lot with high cholesterol. Lowering your carbs, sugar, starches, going with low carb, low paleo, keto, carnivore, all those different diets have similar beneficial effects on the body, meaning that lowers cholesterol. And then handling your stress level into your body. There's other factors. Sometimes there's inflammation going on. And cholesterol is one of the strongest antioxidant, anti-inflammatory molecules that your body makes. So if your body makes a lot of cholesterol, there's maybe an inflammatory condition going on. It could be a virus, could be a bacteria, could be a parasite, could be Lyme disease. It could be toxins like mercury, fluoride, aluminum, arsenic, pesticides. All those can drive cholesterol higher into your body. So usually when we address these factors, cholesterol normalizes. And again, I'm not concerned if it's below 300 because it has been shown that between 2 and 300, that's the optimum level for cholesterol uh, for you to be the healthiest and live the longest. So if you are on statin, you may want to look into these different factors with functional medicine doctors, functional doctors who can look at the toxic level of your body, your liver function, your adrenal function, your stress level. Deficiencies, of course, can be a factor. Pathogens, like I said, parasite, yeast, all those different things can be part of your cholesterol level. So don't be concerned. You're not a higher risk of dying from a heart attack. One of the major trigger of heart attack is a high stress level and infection. 50% of people who die from a heart attack had perfect cholesterol numbers, LDL, HDL, LDL, triglyceride, and so on. And they had a heart attack. The reason of it is a few days prior, they had a really high stressful trauma that happened to that. It could be a death in the family, it could be a car accident, it could be anything that is dramatic for the body, and the stress hormone was so high that the heart actually had some spasm, the muscle, and had a heart attack. The other 50% of people had an infection before, a day or two before the heart attack, like a flu, a cold. It can be all kind of viral and bacterial infection, triggering some type of inflammatory reactions in the body, causing the heart attack. These are the main two factors. And like I said, cholesterol is not a factor. Having a higher stress, higher cholesterol does not lead you to a higher heart attack. Actually, those people have lower risk of heart disease. So I hope it makes sense. So if you have any question, of course, you let me know when it comes to this. Other than that, what you can do, yes, Miss Strike M, Mr. Strike M. So yes, I'm not supposed to be talking about that, but you're totally right. Lately, I have known a lot more people dying from this medical procedure that I've known over the last 2 years, people dying from viral infection. It's really sad, it's really unfortunate, but you're right. Uh, this tool, medical tool, is really toxic and can lead to heart disease and inflammatory response. I'm not going to get into that, but yes, that's really possible. And a lot of people are concerned about clogged arteries. Again, it has been shown decades and decades ago that people who had a heart attack do not, most of them, I think it's 75% of them, do not have clogged arteries. So clogged arteries is not a direct factor causing heart attack. Clogged arteries, when your arteries are clogged, it just means there's inflammation in your arteries. It could be an infection coming from your mouth. That's a major factor there. It could be seed oils like canola, corn seed oil, safflower oil, corn, cottonseed, soybean. All those vegetable fats are highly toxic for your arteries, trans fats that can cause clogged arteries. But the body, the heart, will develop compensatory mechanism to cope with this lack of blood flow in those arteries, meaning that your body will make other blood vessels to get the blood to the heart. It has been shown in the 20s and 30s from autopsies that people with heart attack did not have clogged arteries. But if you're concerned about clogged arteries, there's a few things you can do. You can use NATO. NATO is a powerful enzyme that remove junk from your arteries. I had a patient of mine, he came to me with 90% clogged arteries. And we used NATO on him and a keto diet. Over 6 months, 70% of their clog uh, was eliminated by this protocol. So you can use butcher broom, which is an herb as well, garlic, ginkgo, cayenne pepper, um, horse chestnut. These are another herb. So all those different herbs and products can be used to cleanse and detox your arteries. But at the end of the day, you have to address the root cause, which is stress, diet, infection. Hope this makes sense. If you have any question, you let me know. Thank you guys for watching and God bless you.